Hello everyone, welcome back to Omega Star Pup Academy. I'm Micah, I'm here with Angie, and we're going to be continuing our health series. So today's video is going to be about luxations, heart murmurs, and bites. So it's kind of a health series we've been doing on some of maybe, I wouldn't call them common, but just some of the things that can pop up if you are considering bringing a puppy into your home. And just the biggest thing here is to not fear. This is education. Neither one of us is a vet. We're just speaking from experience. And Angie's been doing the last couple on her own. And I thought I would jump in and just help out with this one a little bit more. We might do a little bit more interview style. We're not sure, we've kind of been feeling this out a little bit, how these are going. But again, our main goal with this is to impact culture. We want people to be educated on puppies, raising, health-related things, day in the life of a breeder, breeder perspective, ask a breeder. There's all these topics that we're trying to just be a little bit more open about, the world of raising puppies. So, we're not, there's varying levels to raising puppies. Some are for show, some are for work. Some are for just enjoyment and companions. Some are for therapy. So there's a lot of different avenues that a puppy will eventually adventure onto. So that's part of what we exist for, is just to kind of help be a little bit of a positive light, education in the whole culture of puppies and raising. And so, without further ado, we're going to get into some of these health topics, and we'll have Angie speak a little bit on some of those.
So we're going to start off on luxations. Like Micah said earlier, that a lot of these are just to bring awareness. So I really am appreciative for these videos because in a breeding world, when we raise puppies, we want perfection. We strive for perfection. And when that vet tells the breeder that you have a luxation.
So can I quickly say, so most puppies have a vet check done at about 6 to 7 weeks, is kind of that first initial
check, we call
wellness check. And it's just kind of a general, like you just said, a general wellness check. There's usually 10 to 15 items that a vet is kind of checking off. Everything from weight, body composition, ears are clean. There's a whole bunch of physical things that they're looking for. Just a general wellness check that is done. And most of these items that we've been talking about are things that can come up in those wellness checks.
That's right.
So a lot of times how it happens is a breeder will get that wellness check back, the results. If they're perfect, that's amazing. You can share that with your client, and everything usually is smooth. But sometimes you do have an item. We've covered parasites. We've covered what did we do? Hernias, vulvas, and some of those different things like that. And today, items are also things that can pop up.
So in that wellness check, when you have 9 or 7, say 7 in the litter that are perfect, and she says this one here has a luxation. And initially you may, like even from the breeder standpoint, be like, oh, right? And then they're going to go ahead and grade it. So what is a luxation? It is a slipping in the kneecap. So it's just slipping out of the groove that is formed there. And what can cause it, we talk about puppies' development and how they're born as neonates. And that means that eyes and ears are going to develop in those first 2 weeks of life. What also, we don't put a whole lot of focus on, is that the rear legs are actually really parallel with the body, parallel with the ground, I guess is the best way to phrase it. So they use their front legs to get themselves towards the nipple to nurse, to move around. Those rear legs really are like little seals. They kind of just flop back there. Really, there's no strength, there's no muscle tone. It's very interesting. And so when we talk about like progression through like Omega's program, week 3 is really where I call it, they get their sailor legs. Like they just get those little legs in there. They wobble, they toddle. They look like drunken sailors. Or if you've ever been on a cruise ship, how you channel this way and you wobble this way and that's how they act. In fact, I have a little story with that. The first litter that we raised, our son at that time would have been probably early high school years, maybe 8th grade. He came shooting through the door. He's like, Mom, something's really wrong with these puppies. He's like, they're wobbling every which direction. Well, come to realize, they hadn't been walking at all yet. So that progression, that muscle tone is a development stage. And so some breeds are more prone to having luxations than others. It has a lot to do with structure, conformation, exposure. That's why
How fast they develop.
How fast they develop. Growth is another factor, like your larger breeds, smaller breeds. But that's why at week 4 and 5, we do have items and like for them to work on muscle strength. So luxations they're graded. And again, the interesting piece to luxations is it is a vet's palpitation and how they grade it. So some vets grade harder than others. And my personal vet, who does a lot of our work in our region here, is very, very strict. And she believes in calling out every grade.
Yeah. She's very honest.
She's very honest and upfront and a little strict on her grading. But I prefer that because I want to know what we're dealing with. And so the beauty of it is that some of those luxations are graded 1 to 4. And then really, I think there's a few other grades below that, possibly to even 6. Some of those you can work out of them. And Micah and I in the past had a breed that we worked a lot alongside of one another, and we had luxations. They were in Cavaliers, and Cavaliers are known for it, and Cavapoos, yes, are known a little bit more for luxations. And I would say almost all of them, I'm trying to think back over, as a grader 1 or 2 that
Probably
they
3,
were,
4,
we worked it out of them. Just with mobility, actually physical therapy. So,
and I was able to talk to a few clients that were comfortable bringing a puppy home that had maybe a grade 1. Basically, I encouraged them, just keep working with them. Physical activity, they're most likely going to grow out of it. Right. And I think 100% of them did.
That's what I was going to say. I don't think we ever
at
had
a level 1. But I don't know if we had too many beyond a level 2.
No. So that comes from the one thing too that we'll cover is that our breeders believe in ethical breeding, and our foundational, their approach to their adult dogs is very strong. And so majority of that is just also recording, if you have more this pairing that produces luxations is maybe altering that pairing and pair them differently the next time, and then watch the results.
The parents.
Yes, the parent on the parent level. But you can, if you have a luxation, they can be graded. And there are severities within the luxations, and some do require surgery. So those conversations and awareness of what that grade is.
It can develop into future issues that could maybe have a surgery down the road.
Limping.
That's kind of worst case scenario.
It is. And breed specific. There are certain breeds that are more prone to it. So that would be a question for your breeder. Also a question with your vet, how do you feel about this?
Yeah, breeders should be able to give you a little bit of history, have they had this before? What were some of the outcomes? A breeder should be able to share with you a little bit of the history, have some knowledge of what the outcomes of their own puppies, breeding lines, stuff like that. What are the outcomes that they've had in the past?
Well, and even in our instance, when I said we were graded those 1 and 2, so we knew that through physical therapy, basically,
especially
we
at
kind
6
of
to 7
outgrew
weeks,
them.
it wasn't really a fear for us. I mean, it was a bummer. We were a little disappointed, but again, because we always want perfect.
They were usually gone.
But
it's really the strengthening in the joint, and so that joint just has to strengthen up a little bit.
Tendons and so forth.
Yeah. And the other side too to keep in mind is that you can have one not show up at 6-7 weeks, and you get your puppy home, and that first wellness check with your vet, they say, oh, this has a luxation. Because in the growth stage, it's a gauge on how much slippage is there. So Micah's gauge and my gauge could be completely different because it is truly up to the person that is doing the assessment. So that's just something to consider. So,
and that's one reason too, when we bring your puppy home, watch the activity level. You really want to limit. It can be fun to watch a puppy run around and jump off the couch and do all this crazy stuff up and down stairs, but you really want to limit that a little bit because they are still developing.
They are.
Smaller breeds, it's 6 to 9 months to physical development. Larger breeds up to a year. I think Bernice are even up to 2 years until they kind of reach that full physical maturity. So you have to watch a little bit of that as an owner with your puppy. You gotta there's some things for yourself to watch a little bit too for joint health. Supplements are good. Also, NuVet has a really good supplement for joints. There's other ones out there too, but that's kind of one that we're familiar with.
Partner with. It's kind of like just thinking about you don't allow your infant or your toddler to continually jump off the sofa. So you probably shouldn't do that with your puppy. Things are just still growing and developing. And so even stairs, depending on the breed, stairs are acceptable, but not in repetitive motions. So be attuned to that, but don't be scared either. You still have to do life. But as far as jumping off the sofas, I tell my families usually, I don't care what the breed is, not before a year.
Yeah,
just be careful because everything is growing. If they hit that leg a certain way, you can have a broken leg from it. I've had a family have that happen. And it was a cavapoo and it was very small.
Sure.
Shouldn't. So moving on.
Well, I was going to say, so I guess the final point there might be what, basically a grade 1 to 2, and your breeder should be able to tell you like what grade. 1 being the least severe, 4 being the most severe. I think in some cases you said there is like a level 6.
There's a 5 and 6 as well. Okay. Yeah, but I've never experienced anything. Personally, I've never experienced anything beyond a 3.
Okay. So basically a level 1 to 2 is really at a puppy that's only 6-7 weeks old is really nothing to fear at that moment. Again, it's up to the vet. Will tell you if it is a more severe case. Yep. But typically a grade 1 to 2, we're going to be working with that puppy more physical activity, maybe some extra supplementation in the diet. Just really watching and helping that puppy develop safely and grow. And then like Angie said, typically 10 to 12 weeks. Most likely that puppy isn't going to have that anymore, and it'll have a strong, healthy life.
Or it'll be downgraded.
So,
usually
maybe
what
you can
happens,
see a progression 2 to 1.
Yeah, we see it. We saw 3 go to 2, 2 go to 1, 1 go away. It was unlikely if we were 10 to 12 week range that they ever increased in severity. They usually were started out at that. And again, my vet is very, very stringent. So I love her to death, but she's very strict. Awesome. Yeah, she is awesome. So she's very honest. So
so the next thing, bites. Okay, so basically we want to briefly talk about it. Shouldn't be a long subject, but overbites, underbites, basically where the jaw bottom or top jaw line teeth can be out of alignment. And I think that's the next topic we're going to cover. So,
and it's a lot like orthodontics in people. So we're just those orthodontics are realigning the bite. That's what they're after. So they're are again. I mean, this kind of sounds like a general term or general discussion, but there are breeds that are very specific to these. So you may have a puppy or a breed that you're looking at, and they're more prone to that. Some breeds it's standard.
Right.
The underbite, overbite is standard. You see a lot of those English
bulldogs that have the protruding lower jaw.
That little look, and that is a standard in the breed. It has to do with the formation of the jaw. And so there's certain breeds that's standard, some that are not. But even if it's not a standard within your breed, I always tell my families a result back to that. Say, listen, there are certain breeds it's a standard in, and those dogs live perfectly healthy lives. They chew their food just like they should. And so if it was a huge concern, people wouldn't continue to adopt those puppies. And so they're not really life-threatening.
Sure.
Other than the fact that eventually maybe you'd have some dental work later on, depending on the breed. So it's kind of a little bit specific, but it's not scary. It's not alarming. Some breeds are a little more obvious when they have it. If you have like a doodle or somebody with like a breed with a nice big furnishings, you're less likely to catch it. Or notice it.
So it can be a little bit more of an aesthetic thing. Now again, it kind of depends a little bit on the severity.
It does.
So if you have a very severe underbite or overbite, you may want to consider probably a different puppy. It can lead to dental issues, different things like that. But typically it's a very minor. And again, a vet should be able, or you should be able to, the breeder should tell you, maybe how severe it is. Sometimes they will do a measurement. I've had a couple people ask me for a measurement.
Sure.
You can even get the breeder to take a picture or a video and show you what it looks like, and then you can kind of decide for yourself. Are you comfortable with a puppy that maybe has that little bit of a look? And sometimes it can be cute. Other times, maybe it's something that maybe won't want. But
they also can grow out of them.
Yep.
So I've had them be in breeds that are not as common, be what we grade as a slight, again, my vet is very stringent, so she grades everything, but she would say a slight overbite, slight underbite. And I've had by 8 to 9 weeks, because I always recheck every week. If there is something like that, have her check it every week. And I've had them outgrow them.
Yep.
And so it just has to do with the growth, like things are growing. You know how children grow into an awkward stage, that teenage years, we call them, they're just a little gangly. Puppies go through that growth stage as well. And so sometimes things, and the other piece of it too is I always say, like, we have the vet check them at that day, right? So if she'd have checked him 5 days earlier, 3 days earlier, 4 days later, we may have had a different result. And so watching those progressions, and again, if you're concerned, your breeder has incredible insight. They're attuned, they know what their lines carry. And it is, some of the overbite, underbite is genetic. So there is a genetic component to that. But I've also had, like, where I've only had one situation, like one case in all of the litters. So that's pretty isolated. I would say it has more to do with growth and so forth. And that particular pup did outgrow it. So,
So yeah, I think the biggest thing there is severity. What you, as a client, if you're considering a puppy, what you're comfortable with. After talking to the breeder, maybe talk to your vet a little bit about it. But for the most part, it's nothing to fear, especially minor ones. Again, they can get more severe, which could lead to future issues. But typically, just the minor ones aren't too bad. And then, like we said, some breeds, it's just part of the standard.
It's just a standard.
Yeah, so
it's acceptable.
So
it would be unexceptable not to have it. It's really the other side of it.
For sure. So, just depends a little bit on your situation. But so the next topic we want to talk about is heart murmurs. And Angie, if you want to quickly give a brief overview of that, and then we'll get into it.
So heart murmurs, again, are a little more specific, can be more specific to breed as well. My experience with heart murmurs is on the more limited side, because the breeds that I'm really, really involved with do not usually carry them. But they, again, are graded. Different grades. It has to do, they're listening for the valves, the opening and closing of that.
And our vets, when they do the initial vet check, they're just listening with the stethoscope.
Correct.
Is that the right term?
Yeah. Just
so that you can get a puppy tested with what is the right word
a
for
cardiologist.
That?
You could go
with
to
a cardiologist. With echo, is that right?
Yeah,
echogram,
an echogram.
Like
It's for the heart.
So that's a more in-depth look, but
it's like an actual test that's performed. I believe they have to go under sedation for that. But the wellness check at 6 to 7, 8 week window is really a localized. She's doing it local with stethoscope, with so she checking over the puppy.
And it's a rhythm, right? It's a little bit out of the rhythm, or an extra beat in the middle, or something like that.
And she generally can find them at that stage. So I often ask her about them, and she's like, well, if you listen to enough hearts, the right sound for the heart, the odd one out stands out pretty clearly. Again, it can be a development thing. So depending on the grade of the heart murmur, they can easily outgrow that. And again, related to the breed. Breeds have standards.
More breeds
too.
are more susceptible. You are.
And so some do require medication if they're extreme. Families that adopt a puppy with that condition would know what they're looking for. Again, your breeder would have insight into how many times they've had this condition within this mother line and father line and so forth. But heart murmurs are a little more specific and again are graded. And from what I've been told, though, that the grade on the heart murmur is a little more across the board. So if a vet in Ohio, for example, grades it as a 1, generally a vet in California is going to grade it as a 1 as well. Unlike luxations, because they may grade it as a 1 here or 3 here, and they get to the vet in California or vice versa, and they say, oh, I don't even feel a luxation because it's a palpitation. And then sometimes I believe that growth happened during that time, right? So maybe the growth just outgrew it. And I could almost relate that luxation to, our son had bow legs as a little guy, and I had to take him to he had legs made for him where he could not bend his knees. And we called them his legs, and they had a boot attached to it. So every day I had to strap him into these legs, and he had to wear them, was supposed to be for 3 months. But I went for a second opinion. So I always recommend second opinions too. And even third sometimes. Took him for a second opinion. And during that month when he wore his legs it was heartbreaking, by the way, because he had to swing his legs to walk. But during that time, he grew a 1/2 inch.
Oh, wow.
And that second doctor told me that during that bracing period and his growth period, the braces helped him recorrect the condition.
Wow.
So kind of interesting how
Yeah.
it's all graded out, but same things with puppies. You know, sometimes it just has to do with the growth and then the assessment time in between. And so perfection is what we strive for. That's why we believe so strongly in foundational lines, making sure that your parent lines are the best that we can be with doing all the testing we can. But outcomes are that.
Sure.
Like my husband and I have no bow legs in our background, but our son had them, and so like it just happens. And so we strive for the best, and then we go with what we're given.
Yeah. So for heart murmurs, I think main thing is severity. I think in most of these items here, it's severity. Talking to the breeder, understanding what could be the outcome. If they've had it before, you want to talk about the history, and then talking about. What is the outcome if you take the puppy home, and especially with the heart murmur, if it gets worse or something like that, the breeder may want to have like an echo done to really confirm the severity if it's there or not. So some things like that, just could be some items that come up. But again, the purpose of this video is just more to educate, to help take that initial shock or fear away. Maybe if you're doing research and you're Googling. What is a heart murmur in a puppy or something like that. So again, this is just to educate. We're not diagnosing or giving any real medical advice. It's just kind of we're providing a little bit of insight from our experience into these items.
Real life experience.
Yep.
Because oftentimes when you Google, you're just getting a regurgitation of information, and it can be fearful.
Yeah.
And the reality is there's another side to it where a lot of those experiences can show you that like just time and growth within the puppy can sometimes balance things out. And everyone has their ceiling to what they're willing to invest into a puppy and what's comfortable. So you have your cost factors, your time factor, all of that. There's a lot of things that round that out.
When I talk to clients, I always wanted them to feel confident in their decision. Getting that puppy, you want them to feel confident, not feel sorry for the puppy. I want people to feel confident that puppy is going to be strong, healthy, live a long life, and that you're making a good decision. So that was my ultimate goal, and that's part of the goal of this. So we want people to feel educated, confident, and just understanding what happens with the puppy involved. So.
And there's also onto the website. So we have some really great tools now that we're building, some documentation that kind of summarizes information.
We mentioned some other topics. So that we do have those on the website now.
And so all of this will be like kind of laid out for you because we talked a little bit through my son in there with his growth period. And we talked about a lot of things today. So there is some documentation on there if you have specific
other videos.
And it's, again, like Micah said, just experience that we're sharing. So if you have something to kind of give you some background, and then you can further your research or conversations with your breeder or vet.
So some of those links will be in the comments below or the description below. So we appreciate you watching the video. If you have any questions about puppies, health, anything like that, feel free to leave comments and it'll maybe give us some ideas for future videos, or we may reply right there. But yeah, Angie, I appreciate your time, and we'll have some more videos coming. Stay tuned. We have some more like behind the scenes, Ask a Breeder, Day in the Life of Angie. So a lot of those videos and so forth are coming. So please, consider subscribing. Hoping to provide a lot of content that are around the puppy raising culture, breeders,
world,
a little bit more into our world.
So
it gives you a little bit more insight into what's going on before you're, if you're considering a puppy, or if you just enjoy watching for the entertainment, education.
We do have some entertainment with it. We have a good time.
We try a little bit.
We do.
So thanks for watching, and we'll hopefully see you in the next one.